So this is update number 2 on day 4 of the David Burke preliminary hearing from Los Angeles, and I'm going right back into things. But again, this urgent graphic content warning about everything. We're talking about the medical examiner and everything that happened in the autopsy. So I need to make that very clear. We are going back into where I left off, and they went to talk about they were showing the torso that was removed from Hollywood Toe in the photos, and kind of showing where the penetrating wounds were. So the skin defect was on the right abdomen. It was right above the belly button area. And they explained that the wound went through the skin, soft tissue, diaphragm, and liver. And it was about 3/4 inch in length, compatible with a sharp force injury penetrating the skin. And they explained as well that the liver shrinks and loses shape due to decomposition. So the wound could be deeper, but due to how far the decomp is in the body, they're unable to get more specific on that or be able to tell. And that is something that consistently came up, was how severely bad the body was in decomp, that, it impacted some of the analysis. They noted that the wound is consistent with being STABBED in the stomach from front to back, so that the liver showed a defect injury to the diaphragm, and there was a wound track shown once it was removed from the body. They noted that there was multiple nonspecific defects in the liver above the rib, and they said that he pointed it out, but above the rib, you could see part of the autopsy table from being able to see through the body. Now, this was an interesting way to phrase it, and this was clarified kind of by defense later on. He said it could be a gunshot wound, the way the additional trauma looks, that injury to the ribs that was on the left lateral chest. And I'm sure that the court sketch person will do it, but the best way I can explain it is if you ribs and tissue connecting, and within a portion of that tissue there was a hole. So when he said it that way, the injury to the ribs, the defense did kind of go back and inquire about why this gunshot comment, and basically explained it as it's a cortisol disruption of those ribs. And he really means that it could be anything for those defects: a sharp object, a GUN shot wound. I shouldn't have said that word. But they also clarified the defense that there was no object inside of the body related to the speculation of a G wound. And the ME said, yes, but because it was cleared through, it could have been a potential exit wound, which I don't know how much could be, I don't know. I feel like some people are going to take that and really hone in on it. But you have to understand this is a medical examiner, and they need to describe it to the best of their ability and every potential that there is, right? And some of the things that they were lacking. Again, when they were kind of explaining the wounds and the entrance exit and how they looked, they were unable to tell if certain things about it, because the body was so decomposed, that typically they could kind of explain what they think the object might be, the instrument that was used, but they couldn't do the decomp because it wasn't possible. They went on to show a photo of the right knee dismemberment close up, and you could see the small blue fragments that were embedded. And when Beth described this whole scene of the alleged homicide scene and how it could have happened with a dismemberment in a pool, would that all possibly correlate up to what was being shown on the screen? And he answered possibly. Then they went into explaining what the injuries were, if they were life-threatening. He talked about the pneumothorax and said that both injuries to the stomach and the liver are life-threatening. He talked about how the stomach area would restrict breathing, movement, hemorrhaging. The liver is a major organ that leads to bleeding. They went into the left chest injury and said that it would take minutes to pass away from it. They also asked how much liters of blood is in an adult, and they said 5. But then they clarified, well, what about it? And this is what's you have to remember. Then they have to say, well, what about a child? Because this wasn't an adult body. This was a 14-year-old body. And he said he didn't know off the top of his head, but because it's a smaller individual, a child, 14 years old, it would be less than 5 liters of blood in the body total. And then Beth really kind of honed in as the date of death was September 8th on the autopsy report, only due to the fact that that's when she was found, and reiterated that her birthday was September 7th, 2010, and wanted to emphasize that she didn't make it to her 15th birthday. Was that correct? And of course, the medical examiner said it was correct because she had been deceased before then. And they only did that date because that's just when she was found. Regarding the liver injury, again, they described it as a life-threatening injury, and they would expect to be significant hemorrhaging. And when they were talking about the BLEE out time would also take minutes to be deceased. When they went to minutes, they also said like a few minutes or hour up to an hour. And he said, well, there's, again, it's kind of like this weeks and months things. He said there's minutes within an hour, so I will say minutes. Going back in, there was a break, and then we talked about the manner of death, which they determined was homicide, and describing that it means death at the hands of another, and they identified it as multiple penetrating injuries, which to them just means more than one. Now, a reason that they were delayed on finalizing the report is due to a toxicology screen, because they had to test different levels. They said that the alcohol was barely above a limit of detection, indicating a postmortem change. And, it's something that typically occurs. And they said it was really just above a level of detection, that any lower would have been a negative result on the toxicology. When the drugs came up, there was benzos and methamphetamine initially, but the confirmation testing on that, concluded that the benzo was negative and the methamphetamine was inconclusive. But the ME went on to say that if they were present, they would have nothing to do with the cause of death. Then this went on to cross-examination with the defense. As always, cross-examination, prosecution starts with their history as well, but then defense goes into their history as well, questioning, okay, how many cases have we worked on? And again, he said over 2,500 autopsies. And then she went specific, okay, well, how many decomp cases? And he said, probably in the low hundreds. And then she went even more specific. Well, how many dismemberment cases have you worked? Few and far in between. And they eventually got down to potentially less than 25 cases. So I always question when they're doing that, if they're trying to maybe discredit a little, like, do you have as much expertise in this specific area? And then they also went into talking about how Dr. Naum, that helped with this, was a fellow that was training under Dr. Ho. But Dr. Ho explained that they worked hand in hand. He was supervising, but they did the autopsy together. Now, they did hit upon some things, just verifying through questions where Dr. Ho answered that, he can't tell how long it was in the car and if dismemberment occurred at all at once or at different times. He says that he has no training when it comes to tools of dismemberment specifically, because they kind of questioned about that. And that when they talked about power tools in the ME's office, he says, well, they do use them to cut through rib cage and skull, because she was kind of questioning, like, what's your expertise in the area of knowing that power tools cut through whatever. And then again, they just noted like, oh, so you didn't have the other two fingers to examine, like they weren't available to you? Like, yeah, they weren't available because nobody knows where they are. I mean, say it that way, but I mean, sometimes the lines of questioning from defense, like, I know it's their job, but it's just, yeah. Let me see. I mean, they did note that the criminalist on hand at the Hollywood Toe did search for those 2 digits missing from the hand, but they couldn't find them. They, again, went over the left eye was severe decomposition and couldn't tell if it was missing due to decomp or anything else, but essentially it would have been the severe decomp of the body that would cause the eye to be missing. Again, that part of her face was already skeletized, so there's nothing there. Okay, I don't have much time. I'm going to try my best. I still have like more paper to like summarize what happened then. There was just no blood remaining in the body when it was autopsied. They talked about how much, like the liver and the lung weight and all of that stuff. And let's see, they talked about when it was complete. And again, when the tox came back, they determined that the penetrating injuries were a cause of death, and the defense verified, so there was no OD. to those other items? He said no. Then the defense went, and you could feel the tension in the room when this line of questioning came about, was asking if the history of the individual will be helpful. So referring to Celeste, like, did you speak to the family about her characteristics or about her? Know much? You know, and he said no. And he said, well, would it be helpful if you knew if somebody is suicidal or if they're violent or about their mental health? And he said, you know, yeah, it would be helpful. But he didn't know. But they went that route. And again, I think the gallery in the room, like, you're listening to that, and that was really hard to listen to. Like, if that's trying to be used as, you know, potential defense or reasoning excuse. Then the defense went on to talk about the wounds. And I noted something interesting because the defense, she referred to them as, quote, stab wounds. And the ME, when he replied, again, he keeps saying they're penetrating wounds as the cause of death. And the defense said, well, you can't determine if Celeste was holding an instrument that caused these wounds. And the ME explained that if that's the case, there would be hesitation marks and uncertainty marks that they'd be able to identify in an autopsy, and those were not present. The defense went on to say, well, you don't know then under what circumstances these injuries occurred. And they also said that penetrating versus sharp injury due to decomposition, you can't tell the details to identify anything else. But the ME said that these were all most compatible to a sharp force injury. Then the defense was also talking about, okay, well, you can't tell the size of the instrument used, if it was sharp or pointed, and if it was the same used for each wound. It could have been different instruments. You know, and again, as an ME, they have to say, yeah, because they don't know. There's no definitive answer to that. The defense went on to ask if the ME is able to tell if there's a struggle that could have occurred that caused these injuries. And of course, the ME says that they can, and especially due to the decomposition, they can't tell if there's a struggle. There were some scrape wounds on the back of a hand, but there's something else that can be told due to the condition of the body. And the defense was saying, so you can't tell the speed at which the body is moving regarding the wounds. So again, it seemed like they were trying to imply things or alternative theories or concepts or possible defense things that could come out in a trial. You could kind of see how their brain was ticking in that sense. They wanted to verify that you can't tell the bleeding was internal or external, and the ME agreed, saying, but that, however, though, there typically would be BLOOD due to the fact that there's an open wound, and that the fact that when you say that you are letting out, it means that it's coming out of your circulation of your body, so it can be internal versus external. Now, I did note, because the defense put back up the exhibit of the photos of the back of the hand where the fingers are missing and the finger. And I noted that David this time was looking right back at the screen the entire time when those photos went back up on the TV, and he didn't seem to look away. There has seemed to be really no reaction to these photos that are affecting the rest of us that are seeing them, because they are just horrific. Yeah, the only other thing the defense really covered was that, like, oh, the detective allowed to dispose of the black bags that were in the front, and that no tools were given to the ME for comparison to these dismemberment cups. And he's like, no, of course not. They don't go into that, like, in an autopsy. That was kind of where we left off, and then we're at lunch right now, but I wanted to try to get these updates as quick as possible. Those are the facts of it. There's a lot that I want to say and that's on my mind, and the family, just so we know, they were not there for this. I think they knew they were not going to be there during this part of testimony, but that's the end of Dr. Grant Ho's witness testimony. So when we go back in, somebody else will be on the stand. And I'm going to have to head back in. I don't have much time. But yeah, it's a, yeah. I'm just going to end it here, honestly, because I just can't. Give more of those. Just going to read off my notes and give you those facts for now, and I'll talk more about it later. But just want to get that out and take a breather before I have to head back in 10 minutes.